is important because I have 6 grandbabies. I want to live to see them get married and walk across the stage in graduation, and me being healthy is important.
Everyone deserves quality care. We focus on quality measures, and it is ingrained in everything we do. We care what our patients think. We want their patient experience here to be as good, if not better, than anyone else's in this community.
We are essentially the foundational portion of the safety net as far as healthcare that our patients receive. We do not turn patients away. We are always here for patients regardless of their needs.
Health Partnership Clinic has invested significant resources in being able to provide integrated services to our patients. What that means is when an individual comes to Health Partnership Clinic, they get far more than primary health care services. We are really striving to take care of the whole person and being that one-stop shop for our patients.
When they see how serious we are about performing well, the patient then feels reassured that we're taking care of them.
Health Partnership Clinic has always embraced new things. This is our way of staying abreast of the best quality of care that we can bring to our patients. This ranges from whether we're asked to start a new school-based clinic to working with a pediatric practice to ensure that their patients continue care with us once, say, a provider has retired. One of the key areas where we've risen to respond to the need is with the opioid crisis. From growing our behavioral health staff to also adding substance use disorder treatment, group counseling sessions, but now also adding medication-assisted treatment.
We use FDA-approved medication treatments to help patients who are dependent on substances, to help them stay off of those substances and at the same time help keep them out of withdrawal.
I just knew something had to be done, because if not, I was headed probably for a lot of destruction when it comes to this disease.
So we'd recognize that in our community we do have a high proportion of patients who have diabetes, and it was difficult to control them just in one of those quick 15 to 20 minute visits. And also it's known that with diabetes it's a multifaceted disease. You need not just medication, but you need education, you need support and counseling. It is going to be with them for their life, and so there's just more intense treatment that's needed.
Today I got good news that it's at 9. It's not where it should be, but it is going down. And it's due to the fact that I don't have to worry about the medications, because I get them free through the program.
So this is a major benefit that helps break down barriers for our patients, because we know that one of those barriers is access to expensive medications like insulin.
I have everything I need, so it's up to me now to do the work.
The Mobile Integrated Unit is a perfect example of taking our services to meet the community where they are. It also highlights what federally qualified health centers do well, and that's partnering. Partnering with the fire department is a natural fit for us to go out into the field, to see people, to meet them where they are, and to provide services.
The Mobile Integrated team gets healthcare and other resources to people in the community that might not be able to reach it otherwise. So we'll do history and physicals for adults that need them. We'll do history and physicals for kids in the schools if parents are unable to get them into a clinic or don't have the finances to put them into a clinic. And there's some people that we see that are experiencing homelessness or recent changes in family dynamics, people that are new to Olathe or new to the country.
Health Partnership Clinic is really an important place to provide the dental home, especially for those who have Medicaid. There are very few dentists who accept Medicaid, and so as one of the only providers here in Johnson County, that's a home for these people to get the care and get really good care. We have several dentists here that provide the care, and myself as a pediatric dentist, I can bring that service to children who would not otherwise have that access. So we actually go into the schools, do screenings to determine kind of what's needed, and then also work on prevention.
So at Health Partnership Clinic, we follow an integrated behavioral health model, which means that our behavioral health clinicians will come in during a primary care visit, whether it's pediatric or adult. It's a short visit and it does not include individual therapy. It's a brief assessment and some brief interventions to help prevent and then manage any stress or mental health issues. We have a partnership with Heartland Radac, who provides us a licensed addiction counselor on site at our Olathe clinic 2 days a week, and we're really excited to be able to offer ongoing outpatient substance abuse services. And what that means is they'll meet with an addiction counselor once a week. We also have a group that patients can attend as well, and the most important thing is that we can provide access to care. So regardless of ability to pay, patients are able to access those substance use services.
I think the most critical action that we took was to always make sure that we were here and that we were open. One opportunity that came up that really helped us stay open and be there for our patients was the move to implement telemedicine here at Health Partnership Clinic. So there are other technologies that we're always looking at. We are working with United Healthcare Group to pilot being accessible to an Alexa type function.
I found a few doctors near you. The first one is Health Partnership Clinic,
where patients can find out how to make an appointment with us. So when it comes to partnerships, when it comes to technology, when it comes to the diversity of our staff, there are always new opportunities. One designation that we're very proud of at Health Partnership to have is that of the Patient-Centered Medical Home. That is a designation that recognizes all of the efforts that we make to ensure that the patient is taken care of.
The community helping spread the word about Health Partnership Clinic. That is a key way in which they can spread our mission, to make sure that we are known so that people that need our services can come to our doors.
It's very important for me to be able to have a health partnership in this community to help me with my health issues, because if not, I don't know what I would do.